If you are viewing this video, you may have just found out your child or a child you know needs or has recently received a tracheostomy. So many fears and anxieties come with this news, such as, how will I cope with all the care needed for this child? And will my child be able to develop normally? These types of thoughts and questions are normal, and that is why this video was produced, to help you obtain the information you will need to care for your child's tracheostomy, and to help you make the transition back to home. Another resource which will also help you prepare for your home is this booklet, A Parent's Guide to Pediatric Tracheostomy Care, written by Mallinckrodt Incorporated. The information you receive in this video does not replace the specific instructions that the healthcare team caring for your child will provide. With the help of the nurses and other members of the healthcare team, you will be participating in your child's tracheostomy care. The more hands-on practice you do in the hospital, the more comfortable you will be when it is time to go home. It is also a good idea for several family members to receive training so that all the responsibilities of care do not fall on one person, who at times will need a break. Before we get started, it is helpful to first discuss just what a tracheotomy is. A tracheotomy is a surgical opening in the neck into the windpipe or trachea made by a surgeon. This opening is called a stomosite. A curved plastic tube called a tracheostomy tube or tracheostomy cannula is then inserted through this opening into the windpipe. This makes a new airway that the child can breathe through. Let's discuss why a child would need a tracheostomy. There are many reasons. For example, a child may have an obstruction or blockage in the upper airway. He may have difficulty in managing or removing mucus from his airway. Or he may have trouble breathing that requires assistance from a breathing machine or ventilator. These can all be indications for a tracheostomy. Your doctor will explain the exact reason your child needs a tracheostomy, but in general, a tracheostomy is put in place to help your child breathe easier. Shiley tracheostomy tubes are usually made out of soft, flexible plastic and are curved for comfort. The tube portion of the trach is referred to as the cannula, and the wings on each side are called flanges. All tracheostomy tubes come with an obturator or introducer, which is used to help guide the end of the tube into the stoma or opening of the neck. Once in place, the tracheostomy tube is secured with cloth trach ties that fit snugly against the child's neck. Shiley tracheostomy tubes come in various sizes with different options. Most children will use a standard trach tube. Some children may require a special type of tube with an air-filled balloon cuff, which makes a seal in the airway and is used when a child is on a ventilator. Some children may be fitted with a tracheostomy tube that has an inner cannula. Depending on the type of tube available, the inner cannula may be either a disposable type, which is discarded when soiled and eliminates the need for cleaning, or a reusable type which can be easily cleaned and reused. As children grow, so does their airway. Therefore, it sometimes becomes necessary to change the size of the Shiley tracheostomy tube your child is using. Your doctor will let you know when this is necessary. During this video, you will be shown general care techniques of the tracheostomy, including suctioning, changing the trach ties, cleaning the stomosite, and changing the tracheostomy tube. With each of these, there are certain supplies and equipment that you will need to have at home. Your healthcare team will help make the necessary arrangements to assure that you will have all of the necessary supplies before you go home. Mucus or secretions are naturally produced in the airway and are normally swallowed. When a child has a tracheostomy, the mucus is moved up to the point of the tracheostomy and then requires coughing or suctioning to remove the mucus from the airway. Some children do have a strong cough and can remove the secretions without frequent suctioning. But most children will require suctioning periodically or when in distress due to an increase of secretions. Common times for suctioning are upon waking, before meals, and before bedtime. It is important that you only suction when necessary. Suctioning too frequently can actually stimulate production of more secretions by irritating the airway. If your child becomes sick with a cold, the need for suctioning may significantly increase. Signs that your child needs additional suctioning may be increased coughing, becoming restless and agitated, having retractions, which are evidenced by a sucking in between the ribs at the base of the neck or just below the rib cage, difficulty breathing, or skin color changes. These are all known as signs of respiratory distress, and if they continue, you should notify a member of your child's healthcare team. There are several acceptable techniques used when suctioning your child. These include sterile technique, in which the suction catheter is sterile and sterile gloves are used. Modified sterile technique, in which a sterile catheter is used with clean disposable gloves. And clean technique, in which a clean suction catheter is used with disposable gloves or freshly washed clean hands. For the purpose of this video, we will be showing you the clean technique. Here's what you will need to suction: suction machine, suction catheter, sterile water or distilled water. Sometimes normal saline drops may be used, but routine use is not recommended. Suction catheters are small plastic tubes and come in various sizes. Your healthcare team will instruct you on the proper size catheter for your child's tracheostomy tube. Regardless of the technique you are taught, it is always important to start by washing your hands with soap and water. Hand washing before and after all tracheostomy care is the #1 thing you can do to help prevent infection. Non-sterile disposable gloves should be worn for the protection of any caregiver that is not a family member or by anyone who is concerned about infection. Attach the suction catheter to the suction machine tubing. Turn on the machine. If your suction machine has a pressure gauge, it should register between 80 to 100 millimeters of mercury. Your healthcare team may instruct you to put 2 to 3 saline drops into the tracheostomy tube to stimulate a cough. Gently insert the catheter into the tracheostomy tube until it reaches the end of the tube. This is called pre-measured suctioning and is accomplished by measuring the length of the trach tube and only passing the suction catheter to this pre-measured length. To find the proper length for suctioning, pass a catheter through a spare tracheostomy tube of the same size and mark this measurement on a card. It can then be used as a guide for pre-measured suctioning. Avoid passing the suction catheter beyond the end of the tracheostomy tube in order to prevent irritation to the trachea. Place your thumb over the suction port opening and insert the suction catheter into the tracheostomy tube. Roll the catheter between your thumb and forefinger as you remove the catheter. It should take no longer than 5 seconds to insert and remove the catheter. If you need to suction again, rinse water through the suction catheter and wait a brief period of time for your child to catch his breath before repeating the procedure. Observe the characteristics of the secretions. Normal secretions are clear to white or occasionally have a yellow or greenish tint with no odor. Abnormal secretions are yellow or green in color with a foul-smelling odor. Discolored secretions may be a sign of infection, especially if accompanied by a fever. An occasional small streak of blood in the secretions can be normal, but bright red or old dark blood in the trach, this is abnormal. If you observe these signs of infection or see bleeding in your child's trach, call your doctor. When you are finished suctioning, your home care health professional will instruct you on cleaning and reuse of the suction catheter. Next, we will discuss humidifying the air that your child will breathe in. Normally, when air is breathed in through the nose, it is filtered, warmed, and moistened. A child with a tracheostomy does not breathe through his nose, and therefore the air breathed through the tracheostomy is dry air. This tends to dry and thicken the secretions, making it difficult to remove with suctioning. This can lead to the mucus plugging up the tracheostomy tube, which can be very dangerous. Some options to increase humidification are humidified air delivered by a trach mask or the use of an artificial nose. Your healthcare team will arrange for a proper source of humidification for your child's tracheostomy and will instruct you on proper use. Skin care is important in order to keep the tissue around the tracheostomy and neck clean, free from infection, and to prevent pressure sores. Skin care should be performed at least once a day or at the frequency instructed by your healthcare team. You will need half-strength hydrogen peroxide and sterile water or normal saline, cotton swabs, a towel roll or blanket roll, and a pre-cut split 2x2 trach gauze dressing or stoma pad if recommended by your healthcare provider. To make the tracheostomy site care go more smoothly, it is helpful to gather the supplies you will need ahead of time. Always begin by washing your hands first. In a small container, mix a cleaning solution of half hydrogen peroxide and half sterile water or normal saline. In a second small container, pour only the sterile water or normal saline. This is one type of cleaning solution your healthcare team may instruct you to use, but there may be other approved cleaning solutions. Next, position your child's neck with a towel roll under the shoulder blades to make the site of skin care easy to access. Dip cotton swabs into the cleaning solution. Start at the stoma or opening of the tracheostomy and clean the skin with a cotton swab, moving outward and wiping away from the site. Repeat this with new cotton swabs each time until the entire area around the tracheostomy site has been cleaned. Then rinse the same area by using cotton swabs dipped in sterile water only. If using a pre-cut split 2x2 trach dressing or stoma pad, slide it into position after the area is clean and dry. Be sure to hold the tracheostomy tube in place while positioning the gauze pad. Do not cut gauze because the child may inhale any loose strings. Be sure to change this dressing anytime it is soiled or wet. Tracheostomy dressings may not be needed for older tracheostomies when the skin condition is good and the stoma is completely healed and free from rash or redness. The routine use of ointments and creams should be avoided and never use petroleum-based products. Trach ties should be changed at least once a day or as needed to keep the neck clean and dry. This is usually done at the same time as the stoma site care. Generally, there are two different types of trach ties: cotton twill string ties and Velcro fastening ties or holders. These are the supplies you will need: clean trach ties, blunt nose bandage scissors if using twill ties, towel or blanket roll, washcloth and basin of water with soap. Again, always begin by washing your hands. Place a roll towel or blanket under the child's shoulders. If you are doing this alone and your child is small, It may also be helpful to swaddle the child securely in a blanket to restrain his arms. It is very important to always hold the tracheostomy tube in place whenever removing or loosening the trach ties. This can easily be accomplished by holding your fingers on the flanges. These are plastic wings to each side of the tracheostomy tube. Remove the old trach ties, clean and dry your child's neck with a washcloth, and check the skin for any sore spots, rash, or red areas. Then fasten the new ties immediately. If using twill-string ties, your nurse will be able to demonstrate the technique for replacing these ties. Instructions for changing trach ties can also be found in the Shiley Pediatric Tracheostomy Home Care booklet. Always check the fit of the trach tie. The ties should be tight enough that only the tip of your finger can fit between the tie and your child's neck. Changing the tracheostomy tube can be one of the most anxiety-producing aspects of your child's trach care, but with practice, it becomes much easier. The entire tracheostomy tube should be changed at routine times as instructed by your healthcare team. It should also be changed anytime your child is having difficulty breathing that does not improve with suctioning, or if it is difficult to slide the suction catheter into the tracheostomy tube. Remember, when in doubt, change the tracheostomy tube. Regular changing of the tracheostomy tube will help prevent the gradual buildup of mucus, which can plug the tube. Here's what you will need: a replacement tracheostomy tube with obturator in place and trach ties already attached, water-based lubricant, which is optional, but never use Vaseline or petroleum-based lubricant, towel or blanket roll, and blunt nose bandage scissors if using twill trach ties. Children often require suctioning immediately following a tracheostomy change. Therefore, having suctioning supplies available may also be helpful. First, begin by washing your hands. Insert the obturator into the tracheostomy tube and attach the trach ties. Lubricate the end of the new tube with a thin layer of water-based lubricant or a couple of drops of normal saline. Place a rolled towel or blanket under the child's shoulders and have a second person hold the child's arms while you remove the trach ties. If a second person is not available, a small child can be swaddled. In a swift motion, remove the old tracheostomy tube, visualize the stoma or hole in the neck, and gently insert the new tube. Always insert the tracheostomy tube with the curve of the tube pointing down toward the child's toes. After the tube is in, hold it in place and immediately remove the obturator. The child cannot take a breath until the obturator is removed. Once the obturator is out, you should feel air or hear secretions coming out of the tube. Then fasten the trach ties. If you have trouble inserting the tracheostomy tube, flex the neck back by placing a hand under the neck and lifting up. Do not force the tracheostomy tube into place. If you are still unable to replace the tracheostomy tube, try using a smaller size tracheostomy tube and notify your doctor of this occurrence immediately. Changing the tracheostomy tube may stimulate secretions, and your child may need suctioning immediately following this procedure. After the tracheostomy tube is changed, your healthcare team may instruct you to clean the tracheostomy tube and obturator for reuse later. The tube and obturator may be cleaned using either half-strength hydrogen peroxide, half-strength vinegar, sterile normal saline, or mild detergent. Start by submerging the obturator and tracheostomy tube in the cleaning agent. A scrub brush may be used to clean debris from the outside of the tracheostomy tube. Pipe cleaners may be used to clean the inside of the cannula. Complete the cleaning by rinsing the tracheostomy tube and obturator with sterile water or distilled water. You may want to absorb excess water with a gauze and then allow to completely air dry. In review, notify your child's doctor when your child has a fever along with color changes in the secretions being suctioned from the trach. If food or blood is suctioned from your child's trach. Or if you are unable to replace the same size tracheostomy tube. Call your local emergency medical services if your child has difficulty breathing, which does not improve with suctioning or changing the tracheostomy tube. It is strongly recommended that you receive training on infant or child cardiopulmonary resuscitation, CPR. This may be provided at the hospital, or your healthcare provider can give you information on where to take a class. There is a difference in CPR technique for a child with a tracheostomy. A child with a tracheostomy will need rescue breathing or breaths through the trach rather than through the mouth. To do this, you will need to close the child's mouth and give breaths through the tracheostomy tube using a resuscitation bag or mouth-to-trach technique if a resuscitation bag is unavailable. Next, we will discuss communicating with your child who has a tracheostomy. In order to make sounds, air must be able to pass through the voice box or vocal cords. After having a tracheostomy, most children are unable to pass air through their vocal cords in order to speak or make noises. However, the majority of children will be able to talk with some modifications. Before going home, speak to your healthcare team about communication strategies for your child. Options that may be available for your child depending on his age and underlying airway problems are a one-way speaking valve.
Blow your horn. You can blow better than that. Good job.
Sign language.
What do you see? Horse. Very good.
Picture board or written communication. A speech therapist can be a big help to you and your child in assisting you with an optimal form of communication. Another thing to anticipate prior to being discharged from the hospital is what equipment and supplies you will need in order to travel safely with your child. These supplies include a portable suction machine, fully charged with connection tubing, several suction catheters, normal saline for suctioning, a spare tracheostomy tube the same size with obturator in place and trach ties attached, a second tracheostomy tube one size smaller, a resuscitation bag, extra trach ties, shoulder roll, scissors, and notebook containing emergency numbers with medical history and description of your child's airway problem. You must have all these supplies with you whenever your child leaves home for any reason. The contents of the bag should be checked at least once per year and updated by your healthcare team as needed. Certain products or substances will be irritating to your child's lungs if breathed through the tracheostomy. Therefore, avoid cigarette smoke, perfumes, powders, heavy dust or cleaning solutions with strong fumes in close proximity to your child. Avoid using fuzzy blankets, toys, or clothing with loose fibers that could be breathed into your child's tracheostomy. Be careful not to dress your child in clothing that fits tightly against the trach or covers it, such as a turtleneck. Supervise bathing in shallow water and do not let water get into your child's tracheostomy. Showers may be permissible in older children. Carefully select the toys with which your child and children around them will be playing. Avoid toys that have small parts that could be removed and put down the tracheostomy. For this same reason, your child should not play in sandboxes. Contact sports are not permitted. We hope this video has helped introduce you to the care that a child with a tracheostomy will require. It may at first seem difficult or overwhelming. Don't worry, all parents feel this way, and with time and practice, you too will become an expert. Your healthcare team is here to help answer any questions you may have and to assist you every step of the way.